This video is to review your frozen embryo transfer protocol, often called an FET. Before receiving your protocol, you likely were put on birth control pills. You'll notice the protocol indicates the date here that you started the birth control pills. It also tells you to start taking an 81 milligram aspirin, often called a baby aspirin. It is okay if you didn't start it with the birth control pills. We just would like you to start taking it now. You can get it over the counter. Here you will find the date that you should take your last birth control pill. Up until this date, you should be taking only the active pills, the first 21 pills in the pack. If you reach the inactive or sugar pills, the last 7 pills in the pack before this date, please skip them and go straight into another pack, taking 1 active pill every day. You should have refills on your birth control pill prescription. Just call the pharmacy and request a refill if needed. If your prescription doesn't have a refill for some reason, just call the office and we will send in a refill to your pharmacy. Some people have spotting or even bleeding like a period on the birth control pills. If you experience that, it is okay. Just keep taking the pills as directed. After taking your last birth control pill on the date indicated here, you usually will have a period within a few days to a week. This is normal and it doesn't matter when it starts. You will proceed with the protocol as planned. Next, you will see it listed here where you will have your first appointment called the baseline appointment. This is to make sure you have not ovulated through the birth control pill and that you are clear to proceed with the protocol. You will have lab work and ultrasound at this visit. You will not receive a call from us after this visit unless there is a reason we need to adjust the protocol. If your lab work or ultrasound shows a need to delay the cycle, we will call you and let you know, and it just may mean you start the protocol 1 to 2 weeks later than planned. Otherwise, no news is good news from this visit. We also ask you that you complete and return any consents we have given you for the FET at this visit if you have not turned them in already. Here you will see a date listed of when you will begin the hormones for the FET. The first hormone you'll start is estrogen. You will take it in the form of a tablet called estradiol. You will start with 1 tablet and take it twice daily by mouth, morning and evening. So you'll be taking 2 total these days. You'll also notice we included the baby aspirin or 81 milligram aspirin on this table to remind you that you will continue it. 2 days later, you'll see that we have asked you to increase the estradiol to 2 tablets twice a day. This means you take 2 in the morning and 2 at night, or 4 total. Then, 2 days after that, you will take 3 tablets in the morning and 3 tablets at night, or 6 total. Also on this day, you'll see we have you starting the estradiol vaginally at night. The tablet you insert vaginally is the same as the ones you take by mouth. There is no applicator, just insert it with your finger as best you can. It is not uncommon to have a bluish-green discharge while using the estradiol tablets vaginally, as this is usually the color of the tablets themselves. Then you simply continue these medications until your appointment, which will be listed here at the end of the table. This appointment will also be an ultrasound and lab work. Again, we will not call you that day with results unless you need to make any adjustments. If the lining of your uterus doesn't look developed enough at this appointment, the transfer may be delayed 1 to 2 weeks, but that's pretty uncommon. Here, you will have the date of when we plan for you to start the next table of medications. You will continue the 81 milligram aspirin. You also will start an antibiotic that you will take twice daily. We usually prescribe Keflex, but you may have a different antibiotic depending on any allergies you have. The estradiol will continue as you've been taking it, 3 tablets by mouth twice daily, and the 1 tablet vaginally at night. You'll also start Medrol, which is just a low-dose steroid pill that you'll take at night. And then you will begin some form of progesterone. We let our patients choose either the injection or vaginal progesterone. If you have recently done an egg retrieval, you likely already chose what type of progesterone you wanted, and we ordered it for you. If you still need to choose a type of progesterone, here are your options. Progesterone in oil is an intramuscular shot in your buttock every morning. This injection usually is the cheapest option if you are self-pay for the medications. You will develop lumps under the skin after it's been given that will be a little tender. That is normal, and most people tolerate it just fine. Endometrin is a vaginal pill. It comes with an applicator like a tampon, and you insert 1 tablet vaginally 3 times a day, morning, afternoon, and night. The pill does dissolve and come out and can cause vaginal discharge, so you may want to wear a panty liner. This is the middle of the road cost-wise. Crinone is a vaginal gel. It also comes with an applicator. You insert it vaginally twice daily, morning and night. The gel sticks well to the vaginal wall, potentially causing less discharge. You may find that you need to do a finger sweep of the vagina every couple of days to keep it from building up too much. This is typically the most expensive option. If you start with one type of progesterone and decide it's not for you, you can change to one of the other options. Just let us know. Then you'll notice that you just continue these medications daily. You'll come in for an appointment for lab work only 1 to 3 days before the scheduled transfer. The last date on your protocol is the day of your transfer. You'll find the time listed here that we would like you to arrive. Please come with a full bladder, as that makes the transfer easier. You'll also notice a couple of things at the bottom of this column. Firstly, if you're taking endometrium or crinone, do not insert them the morning of the transfer. You can insert your daily dose after the transfer. You'll also notice listed 2 pills will have you take the day 1 hour before your scheduled transfer time. The Valium will help you be a little more relaxed, and the Feldene is to keep you from cramping during the transfer. It's not that the transfer is that uncomfortable. It is a lot like a pap smear, but we would like to prevent as much cramping as possible to keep the uterus quiet. You will need someone to drive you here and back home from the transfer, and go home and take it easy the rest of the day. You can expect to be here about an hour to an hour and a half. After the transfer, one of our nurses will review your discharge instructions, but we've listed here at the bottom what medications you'll need to continue. Your progesterone, either the shot, endometrium, or crinone, the estradiol, oral and vaginal, your baby aspirin, prenatal vitamin, and any other daily medications you're taking. It's very important if you run out of any of these medications prior to your scheduled pregnancy test that you order your refills through the pharmacy, as these are needed to support a potential pregnancy. If you have any further questions about your protocol after watching this video, please contact your IVF coordinator and we'll be happy to help you. We wish you all the best in your upcoming treatment.